Welcome to Biz Talk. I'm Ryan Herpin. Today, I want to start with a question that speaks to a lot of professionals, especially in healthcare. What happens when the career you train for is only one version of what you are really capable of becoming? In pharmacy, many people think the path is already written. Clinical practice, retail, hospital, managed care, and maybe academia. But the reality is changing. Expertise can now become consulting, coaching, writing, digital health strategies, personalized health guidance, and business ownership. And my guest today, Ross Found, founder of Off Script Consults. She is a board certified clinical pharmacist with years of experience across different pharmacy settings. Today, she uses that background to help, colleagues through career coaching and business consulting, while also offering personalized health consultations and contributing to digital health through medical writing and review. This is a conversation about career reinvention, right? Business ownership, health communication, and what it really means to take professional expertise off script. So Ross, welcome to Biz Talk. It's such a pleasure to have you here with us today.
Yeah, thank you for having me, Ryan. I appreciate it.
So as we begin, I want our audience, so everyone watching, whether you're in healthcare, business, or a professional field that feels boxed in, to ask yourself this: am I following the only path available or just the most familiar one? I really want to start this conversation with Ross by looking at what it means to rethink a pharmacy career. This segment should open the door to a bigger business conversation, as in how professionals can transform deep expertise into new opportunities. And I've got my own wild experiences in that exact concept. But for Ross, pharmacy is not only a clinical role, it can become a platform for consulting, education, writing, personalized support, and entrepreneurial growth. So the focus here is career expansion, and many professionals build strong technical skills but are never really taught how to translate those skills into broader opportunities. So really, I like to jump right in and get to the heart of these big questions. And digging into your experience, I am curious, when you think about the phrase off script, what does that mean in your own professional journey?
Sure. So for me, it's definitely was fun coming up with this phrase for my business, but it's definitely very applicable to my journey as well. But in general, I think it means using my own professional judgment. I think all healthcare professionals can relate to that phrase, right? Use your own professional judgment to to best help your patient. So the skill set, believe it or not, it looks like it's already there, right? Because all healthcare professionals need to use this. There's so much information out there. For example, there's all these clinical studies, all these treatment guidelines that we were taught to become familiar with and to continue to become familiar with to help our patients. But not every patient fits into a specific clinical study, right? And not every patient fits into a treatment guideline. So because of that, that means that they don't fit into that box. So you need to, depending on the patient, you need to use your own professional judgment to interpret what is available out there for you, but then having to extrapolate that data or that information to your unique patient. So instead of thinking it for just for healthcare wise or for your patient, now apply that same option to you. You don't fit into a box. I didn't fit into a box, right? How can I extrapolate what my passions are, what my skill sets are, and then turn my career into something else with
That's
my
fair.
pharmacy degree?
And that makes sense because, like you said, whether it's patient care or our own journeys, we all kind of have to go off script because it's not just one size fits all. It's not just simply a box that we fit in. There's times where we fit in a box, but there's definitely different directions out there. There's so many different ways we could go. And like for me, I began my career as a certified welding technician, became a master welder, found a good mentor, and then took over a massive manufacturing company. That grew into multiple businesses across the US, and it's grown from there. But I took a different route. People said, you go welder, you're just gonna be a welder forever. Well, I got into upper level business management, now consulting. But with that in mind, what did you notice in pharmacy that made you realize there was room for a different kind of career conversation?
Sure. So I think for me, it's I kind of started a little bit in pharmacy school because I've always enjoyed researching, analyzing data, and writing. But while I was in pharmacy school, I did get into the dual PharmD and PhD program, but I decided not to pursue the PhD part of it further. I like to interact with people more, is what I've come to realize. Even though I enjoyed the research and analyzing data, sitting at my bench all day was, I realized, not for me. So when I graduated with my PharmD, the only options that were available for me at that point was hospital or community retail pharmacy. If I wanted to do clinical pharmacy, I actually at that point had to pursue residency, which is more training. And during that time in my life, that was not ideal to do. So I didn't go that route. And so a part of me, I've always like wondered, hey, I have this skill set. I enjoy researching. I even have some experience in it, right? I enjoy analyzing data and I love writing. How can I also enjoy that clinical aspect. How can I get all of this done and use my pharmacy degree without having to do more training with a PhD or with residency?
Mm.
And then I found myself in a pharmacy manager position at an independent pharmacy. And there, I wore a few little, different hats, and I was able to use all the skills that I just mentioned, right? Because I was able to, in order for the business to be successful, I had to gather data, and then I had to analyze that data, notice trends, make decisions based on those trends. It was applicable more for business than for science, but still the skill set was there, right? And then I was able to use my writing skills to write collaborative practice agreement drafts, do our SOPs, make health handouts for patients. And so I was like, okay, I didn't need residency. I didn't need a PhD to do what I love. I just need to make the role mine. I just need to change it a little bit and it can work out just fine.
And, I relate to that deeply. And here's how it's kind of funny because as you're talking about this, I'm thinking of my own journey, my own path. Because going from welder to, chief operations officer of different companies and now working with many others, I don't have an MBA. Matter of fact, I don't have an actual degree. I'm certified master welding technician. I didn't need an MBA to get where I am today. It just took teaching myself, being interested in things, finding good mentors, and exploring areas that others were really uncomfortable. And through that, you realize what you need is just a belief in yourself, a strong purpose behind it, and a discipline to make it happen. But, you know, you being an outlier, stepping out and going off script and finding a different path here, I'm curious your thoughts on why so many healthcare professionals feel stuck even when they have the valuable expertise.
Yeah, I think that's a great question because I also feel like a lot of the colleagues I talk to, they are very skilled. I admire them as a person and as a healthcare professional, and they're looking for me for advice. And I feel, a part of me when I first started this, I'm like, you already have everything there. What is holding you up, right? But then I think that's how I got into consulting is to make them realize that they are qualified enough because that is their biggest barrier is that they feel like they're not qualified enough. They feel like they don't have enough power to negotiate for what they want, to make the role different, or to go to another setting and negotiate in that setting for what they want, to convince and persuade and market themselves as qualified, that their skills are transferable, even if they haven't worked in this particular setting before. All the skill set is already there, and it's relevant, it's transferable, and as long as they have a mindset to learn, I think that's what they really need to convince themselves before they convince others, is that if you are willing to learn, like you said, willing to have that discipline, willing to question things, willing to become better, you can absorb massive amounts of information and execute new skill sets. So they just need to stop having limiting beliefs, is I think what it really comes down to.
And on that limiting belief, I'm actually kind of interested to dive into that a little bit more. What is the first mindset shift a professional, any professional needs before they can create new opportunities from their expertise?
Yeah, is stop I think they're their biggest doubter, right? So if they stop doubting themselves, they stop. I think the thing though is that in pharmacy, a lot of us didn't start off with a business background, right? It wasn't taught in school. And then we weren't taught to have a marketing background either. So we don't know how to stand up for ourselves in some way. We don't know how to market ourselves and persuade others how amazing we are. And so those skill sets definitely need to be developed. But I think initially they just, how can I say this? They initially always think that they need to ask for permission because that's, for some reason, that was almost like drilled into us that we need something to defend what we're about to do, either if that's a guideline or if that is a study or if that is a prescriber. Or someone else in the healthcare team in order to do something. But I think in the end, what they need to realize is kind of change that mindset when it comes to your own professional career. You don't need permission. Once you notice that you're the only one who gets to decide your life, you're the one you need to ask your own permission. You don't need to
Hmm.
ask anyone else. Once you realize that, all is well in the world and you can pursue what you want.
One of the things I try to tell my mentees early on is you decide your limitations. No one gets to
Yes.
define that for you. And as soon as you realize that, the opportunities seem almost limitless. But, you know, what this reminds us is that expertise does not have to stay inside one job description. When professionals learn how to see the value of what they know, they can build new paths, new services, and new ways to create impact. We'll take a short break, and when we come back, we'll talk about how Ross built off-script consults and what healthcare professionals need to understand about turning knowledge into a business.